Angela Pifer. I'm a functional medicine nutritionist, and today I'm going to talk about why I don't recommend food intolerance testing for my patients. I have had so many new patients call me after they have been struggling to pull the foods listed on a food sensitivity panel, trying to figure out what they can eat. They come into my office and show me their lab, which is covered in red lines, showing that they react to just about everything. And what they always say to me is, this test shows that I'm reacting to everything that I'm eating. So does it make sense to pull all the foods that a food intolerance test shows that you're reacting to? Do these tests have any validity? So let me first distinguish between a true food allergy and a food sensitivity or intolerance. So food allergies are reactions to the proteins that you are eating in foods. A true allergy is an IgE-mediated immune reaction. Now, IgE stands for immunoglobulin E-mediated reaction. You get exposed to a protein in a food, and your immune system is triggered to mount an IgE antibody response. These can either be acute or immediate, or a delayed reaction. An IgE immune response causes a release of chemicals in the body called histamines or leukotrienes. These trigger an allergic response, and this is different for each person. You might get a rash or mouth tingling or mouth or skin sores, itchy skin, swelling, wheezing, or you might have full-blown anaphylaxis. People usually know what they're allergic to. They know what makes their mouth tingle or bring on a mouth sore, and they definitely know what might cause anaphylactic reaction. So food allergies are tested by a skin prick test where the skin is exposed to various food items and then monitored over time to see if a reaction occurs, like a welt or redness. What people are often less clear about is whether they have a food sensitivity or intolerance. So some labs are using bloods to test for an IgG reaction. This is immunoglobulin G. This is a different antibody-mediated reaction. It is an IgG reaction versus an IgE reaction, and it does not result in a histamine or leukotriene release. The IgG immune response supposedly measures exposure of incompletely digested food proteins that have crossed the GI tract and entered the bloodstream, and then it's able to identify the exact food that you have a reaction to. When an indigested protein enters your bloodstream, the only defense that your body has at that point is to mount an immune defense. So the IgG test is looking for an antibody antigen marker for specific food proteins that have entered your bloodstream. So do I think that people had food intolerances that are contributing to inflammatory, neurological, pain, autoimmune, and digestive disorders? Unequivocally, yes. I see this every day in my practice, and it's my job to help people figure out what they're reacting to. Now, do I think that we can accurately measure food intolerances with an IgG blood test? No, we can't. Unfortunately, there's little to no evidence of the efficacy of these tests being used to identify a specific food intolerance. No evidence. IgG testing is used to diagnose certain autoimmune conditions and demonstrate serum immunity to things like measles, mumps, rubella, or Hep B, or even chickenpox. But no validated studies on this testing and replicated validated studies have been done as it applies to food intolerance testing. So now, if you know my blog, I do not always agree with the stances of our various U.S. medical associations, but the U.S. is not alone in this stance. Associations and societies of immunology and allergy from various countries also state that there's no evidence of IgG food intolerance tests, and these include Australia, Europe, Germany, Singapore, and the UK. So we don't even see studies in those countries that are showing the validity of this testing. So one research group in the UK checked out these tests, and it's going to be our equivalent to Consumer Reports. The test claimed to diagnose food intolerances through analysis of blood samples or strands of hair. And what they found is what I see clinically, so I thought I'd share this with you. They found this, that although the researchers actually had just one medically confirmed allergy and one food intolerance between them, the test diagnosed 183 intolerances. Second, identical blood and hair samples sent under different names to the same company produced different test results. And I see this here as well. There's some doctors that I know that have sent in, they actually send in their own blood, and they've done it for patients as well, where they sent it in under two different names, and they get different results. Third, there was little or no overlap between the test results from different companies. So again, if I take one patient and I send it into 3 different companies, where I'm getting just completely different results from each one of them. And fourth, the test recommended excluding up to 39 foods, which could make it really difficult to eat a balanced diet and lead to more nutritional deficiencies and problems. So clinically, for me, it doesn't get much better. I have often found obscure foods showing up on the test, ones that the person has never eaten. I see false negatives, false positive, or the test shows that they react to everything. The only clinical pearl that I glean from seeing a test showing that this patient reacts to everything is that their immune system is being triggered and that they likely have leaky gut, which we would have found out by simply looking at their health history and talking about their current symptom set. What we cannot do with this information, we can't pull all the foods that the patient is showing widespread reactions to on these tests. This will cause more harm than good. When you have leaky gut, you're going to have indigested proteins cross over and enter your bloodstream. The foods that you eat on a daily basis are the ones that will be introduced with such frequency that the test will likely come back showing that you react to everything. This has more to do with the immune system being chronically triggered by leaky gut. So here's the catch. If you pull all these foods over time, you could start to react to the new foods that you start to eat with frequency. And this will also cause widespread nutrient deficiencies in people who are already inflamed because they are now on an extremely limited eating plan. So when a patient says to me, this test shows that I'm reacting to everything that I'm eating, we need to change the understanding of what's going on here. They likely have leaky gut, inflamed mucosal membranes, and the foods that they are consistently eating are making their way into the bloodstream, and the immune system is being hyper-triggered by these. This is why this test is showing that they are keying up on everything that they're eating. Through a conversation with a licensed nutritionist, you can easily identify which main foods you're reacting to. Pull these main offenders and then lightly rotate the rest, while at the same time supporting digestion from the top down. Address your nutrient deficiencies, address the leaky gut, heal your gut, and address your flora levels. We should look at this in this way. A food sensitivity is a symptom that something is imbalanced in your gut. This is what needs to be addressed. I especially sway people away from either running these tests or following these test results when they have a mucosal inflammatory condition, like an inflammatory bowel disease, or gastritis, or esophagitis, or eosinophil esophagitis. If they have a known leaky gut, or an autoimmune condition because their immune system is going to be hyperactive to begin with, or if they have SIBO, these tests will be even less useful. Now, the only time that I have really seen a value to running a food sensitivity panel is when a patient must have a lab in hand that shows them that they have a food sensitivity, and this validation gives them the motivation to finally change their diet. Hands down, I would rather that you spend your money on a digestive stool analysis that will look at inflammatory markers, gut metabolism, flora levels, and overall gut health than spending your money on a food sensitivity panel.